Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.
Hello and welcome to Notice Tonight, the show that decodes the region. The nation is on the 4th day of the 21-day lockdown as part of the massive battle against coronavirus. To be fair to both the government and the citizens, the lockdown has been immensely successful, except for some unaware, irresponsible people coming out in large numbers on the pretext of shopping for essentials or genuinely shopping for essentials. The focus of the government has also shifted towards providing relief to the destitute, needy, and the poor. On its own, the Modi government has come up with a whopping 1.7 lakh crore relief package aimed at farmers, daily wage earners, etc. But the challenge for the administration and the political class is to ensure that the relief reaches those who really need it at this time of crisis. What has governments in the Northeast been doing to provide succor to the poor at this critical time? To talk on the subjects, I am joined from Itanagar by Arunachal Health Minister, Mr. Alo Libang. In Kohima, I have Nagaland Chief Secretary, Mr. Temjen Toy. From Imphal, I am joined by Manipur Chief Secretary, Dr. J. Suresh Babu. Also in Kohima, I have Mr. Menukal John, Principal Secretary Health, Nagaland. From Shanghai in China, I am joined by Madhumita Bhuya, an Assamese resident who actually is into music and dance, promoting Indian classical music in China. And in Guwahati, I have Assam BJP spokesman, Mr. Rupam Goswami. Ladies and gentlemen, welcome to Notice Tonight. Let me go straight to you, Mr. Temjen Toy in Kohima, the Chief Secretary of Nagaland. Mr. Temjen Toy, first of all, really appreciate your joining this program. Now, 4th day of the lockdown. Today is the 4th day of the lockdown. What are some of the challenges that are emerging? How is the Nagaland government coping with this?
Well, the government of Nagaland, like any other state government all over the country, we are trying to give our best, pull in all our resources in coping with this pandemic that has covered the entire globe now. And like as you say, so far as India is concerned, we're on to the 4th day of the lockdown.
Right.
And so far, so good as far as Nagaland is concerned. The challenges we have is especially the laborers, the daily wage earners, especially in the unorganized sector. And we are, so far as our own local daily wage earners are concerned, we have the advantage in that Nagas, we have a very strong community base.
Right.
So through the community, we are looking after, the community has come forward to actually help them out. And then so far as supplies and other things are concerned, we will be entrusting the village councils. But in the urban areas, especially at Kohima and Dimapur, we do have challenges. We already have about 800 migrant workers stuck in Dimapur.
Right.
We are looking after them. We are feeding them. And then we are also trying to identify who are the people who are actually in need of such assistance by way of relief.
Okay, I'll come back to you, Mr. Temjen Toy. We have a lot of things to discuss. I'm also coming to you, Dr. Suresh Babu, in a minute. Let me quickly go to Itanagar, where I have the Health Minister, Mr. Alo Libang. Alo Libang ji, medical preparedness. How are you prepared? आप कैसे तैयारी कर रहे हैं अरुणाचल प्रदेश में? You know, what are some of the main steps that you have taken so far? And आप लोगों को क्या बताएंगे इस संकट का घड़ी में?
नमस्कार। आप जानते हैं अरुणाचल प्रदेश एक ऐसा स्टेट है, लैंड लॉक है और हिली ट्रेन है और यहाँ कम्युनिकेशन का यातायात बोटलनेक्स है। इसी होने का बावजूद भी हम लोग अरुणाचल प्रदेश में चीफ मिनिस्टर, चीफ सेक्रेटरी और सेक्रेटरी हेल्थ का साथ में सब टीम मिलके हम लोग अरुणाचल में स्पेशली कोविड-19 को कंट्रोल करने के लिए एक टास्क फोर्स बनाया है, वो स्टेशन इन ईटानगर। उसी से ऑल डिस्ट्रिक्ट को कांटेक्ट करता है। हम लोग ऑल डिस्ट्रिक्ट में रैपिड रेस्पॉन्स टीम भी रेडी किया है और सब डिस्ट्रिक्ट में हम लोग जितना भी पीपी इक्विपमेंट है, बीटीएम है, ग्लोव्स है, N95 मास्क है, वो सब भी प्रिपेयर करके रखा है। अभी तक हमारा अरुणाचल प्रदेश में ये क्वारंटाइन तो बहुत किया है, लेकिन अभी तक पॉजिटिव केस नहीं हुआ है। हम लोग और 16 टेस्ट किया है, आउट ऑफ 16 4 इज वाइट नाउ। असम में हम लोग ये टेस्ट कर रहे हैं, असम, गुवाहाटी और डिब्रूगढ़ में। हमारा अरुणाचल में लैब अभी तक नहीं है। तो 16 से 12 रिजल्ट वापस आया है, वो नेगेटिव है और सार वेट कर रहे हैं सार के लिए, वो अभी नहीं है।
ओके
तो अभी हम ट्रिम्स हॉस्पिटल जो
Yeah, I'll come back to you. I'll come back to you in a minute, Alolibang ji. मैं तुरंत आपके पास दोबारा आ रहा हूँ. Let me quickly go to Imphal. Dr. Suresh Babu is the Chief Secretary of Imphal. Appreciate your joining me on this show. Dr. Suresh Babu, you know, after the first positive case, you know, in the entire northeastern region, that 23-year-old girl which emerged in your state, that is Manipur, there was some amount of confusion and panic among the people. I think people are settling down now. What are some of the steps that you have been taking to make people aware that there is nothing much to worry about, while at the same time we cannot be complacent and we have to be ever vigilant? Dr. Suresh Babu.
Actually, this girl is not a resident here, but she is studying in UK. She has come back from UK on 19th and reached Imphal on 21st.
Right.
So the moment she reached, she is put on home quarantine straight away. And on 22nd, the next day, Sunday, is a total public curfew. So there is no movement. She is there at home. She was there at home. And on 23rd day, that is on Monday, she has developed some symptoms and she has tested positive. Now immediately the entire family has been put on home quarantine. Of course there is a little panic among the people, but the girl is stable. She is recovering fast and she is out of any oxygen support. She is able to eat and sit and walk normally in the isolation ward there in the Jennings.
All right. The good news. Good news from Manipur is that a 23-year-old girl is stable and fast recovering. That is what the Chief Secretary, Dr. Suresh Babu, is telling us at this point in time. Dr. Suresh Babu, what are the biggest challenges? I was asking your counterpart from Nagaland, Mr. Temjen Toy, what are the challenges? Today is only 4th day of the lockdown. What are some of the challenges facing the administration? What about food supply?
See, the main challenge will be the supply chain. See, Manipur, Nagaland, these are the states which are at the terminal part of eastern part of India. Now, unless the supply chain remains intact, we will be suffering. We have closed our international borders, so we cannot get anything from across the borders. The trucks which were in transit have already reached. We have unloaded them, but we are worried about the next line of supply because not many trucks are moving from Guwahati. The markets in Guwahati are also not able to supply the required material to these states.
Right.
And at the same time, we also doesn't have enough manpower, drivers and handymen. So we got supplies for another 1 week. Unless we replenish the stocks again, we'll face some problem at that time.
So, you know, I will come back to you in a moment. Let me go to the Assam BJP spokesman, Mr. Rupam Goswami, before coming to Mr. Manukal John. You know, Mr. Rupam Goswami, you know, the Assam government is demonstrating an active, proactive role insofar as, you know, taking the preparedness is concerned. You know, a 1,000-bed quarantine facility is coming up at the athletic stadium of Sarusazai. The health minister has announced 5, you know, makeshift hospitals, which is coming up in a couple of weeks' time. So these are some, and the medical colleges have been converted into exclusive COVID hospitals. Private sector has been roped in. So are you a happy man, Mr. Rupam Goswami, today?
Of course, Wasbir, we are really happy the way the Chief Minister of Assam and Health Minister of Assam, both the Health Minister, they are really working very hard to bring the infrastructure much higher than the present level. They have really now we have came to know from the media that already GMCH is been made totally corona hospital. So
Yeah,
that is a wonderful job done by the health minister.
right.
Also, he is working, both the health minister, Dr. Himanta Biswa Sarma and Piyush Hazarika, both of them are
Okay.
working very hard to bring the
Right. So
infrastructure.
that is
Also,
what is necessary at this critical juncture to provide confidence among the people. Mr. Manukul John is the Principal Secretary Health Government of Nagaland. Mr. John, what is the medical preparedness? Do you have sufficient medical gear, the personal protection equipment for the medical staff? Do you have enough quarantine facilities in the state? Okay, let me take this question.
Wasim, he's not connected at the moment.
Okay, if you can answer, Mr. Temjen Toy, what is the medical preparedness in Nagaland?
Well, so far as this virus is concerned, I mean, it has caught every one of us by surprise. But then we have taken steps one at a time. We have declared 2 hospitals as COVID hospitals, 2 government hospitals, and also 1 private hospital in Dimapur, 2 in Dimapur and 1 in Kohima. And the inpatients of those hospitals have been shifted to other private hospitals, and then they are actually coming forward to help us in a big way. So far as equipment and other PPE and masks and other things are concerned, we do have a shortage like everybody else, but just this morning we have received a few thousand of PPEs and more on the way on Monday. There was a very severe shortage of hand sanitizers, but then thankfully the Science College here in Kohima, the chemistry department, they had taken the initiative, and then they have been making hand sanitizers for distribution to public institutions
Very good.
and for all other users.
Mr. Temjen Toy, good to hear the Science College Kohima, preparing the hand sanitizers and, taking care of the shortfall, because by the way, Kohima Science College had been my alma mater. I had studied there. For your information. I'll come back to Dr. Manukul John, the Principal Secretary Health. Mr. Manukul John, what about medical staff? In Assam, 600 to 700 final year MBBS students have been almost recruited, to take care of the COVID patients if at all they are necessary. From today, the training has started. 7 days intensive training for the 700 final year MBBS students. What kind of a contingency plan do you have as far as medical staff is concerned? Mr. John.
Yeah, at the moment, I saw the order that was issued by the government of Assam, and unfortunately, we do not have a medical college in our state. But the second contingency plan that we are planning is, in case some of our medical students, final year medical students, have come back home, we are making an appeal to them, and we're issuing the orders tomorrow, if they can come and help us out.
All right.
And also the retirements.
Yeah, let me also add, we're also making an appeal to people who have retired recently as to whether they would like to come back and help out the government. We are making an appeal for that too.
So 2 important points coming from Nagaland. One is that they have made an appeal to the retired medical professionals, the doctors, to, if they want, they can come and help the government. Number 2, medical students who have returned home to Nagaland, who have been studying in different parts of the country. The Nagaland government has made an appeal and seeking their support. Dr. Suresh Babu, what kind of a contingency plan? Are you in touch with the army authorities? Because there is an army presence, Assam Rifles and so on. Are you working in close cooperation?
Yes, we are in touch with the army authorities. The GOC and also Assam Rifle are in touch with us. So as far as the contingency plan is concerned, we got 2 medical colleges here. the Jawaharlal Nehru Institute of Medical Sciences and also the Regional Institute. We have earmarked separate wards for the positive cases. We also got isolation wards there. In addition, we are training the people. Today we have procured the material and it is brought by cargo from Delhi. We are bringing the personal protection equipment and also the masks, sanitizers and all. In addition to this, we have opened about 14 quarantine centers where we got about 208 people under observation right now, and another 480 people are put under home quarantine. So we have constituted teams to go and visit these houses, whether they are regularly following the prescribed SOP, whether they are strictly at home or not. And in addition, we also appointed senior secretary level officers to look after each of these districts and coordinate. So this is the arrangement what we are making. And simultaneously, we, as Nagaland CS said, we are also developing local sanitizer. The Manipur University Biotechnology Laboratory has developed its own sanitizer.
Okay.
In addition, we have encouraged the startup firms to take up this sanitizer production.
These are very positive news. These are positive developments in these critical times, as the Chief Secretary of Manipur has said. Alo Libang ji, Arunachal Pradesh बहुत ही far-flung area है, mountainous state है, काफी it's a spread out kind of a state है. तो आपको क्या स्टेप्स आप ले रहे हैं गांव-गांव में ये इंफॉर्मेशन पहुंचाने के लिए? रिलीफ सप्लाईज एक कठिन मामला है. इवन इन नॉर्मल टाइम्स इट इज डिफिकल्ट टू प्रोवाइड रिलीफ इन अ स्टेट लाइक अरुणाचल प्रदेश. तो आप ये रिलीफ का बारे में आपको क्या मतलब स्टेप्स आप ले रहे हैं?
हम लोग ऑलरेडी बापारिस्टक जो अपना डिस्ट्रिक्ट में रेडी है
जी,
बापारिस्टक है, उसी से हम लोग दे रहे हैं. लेकिन हमारा गांव में बहुत पहले से रीति रिवाज है जो अपना मतलब सब्सिस्टेंस के लिए हम लोग खेती करते हैं, तो उसी से गांव वाले होते हैं. मैक्सिमम टाउन में तकलीफ होता है, गांव में अपना खाना पीने के लिए प्रॉब्लम नहीं है.
ओके, तो आप व्हाट अबाउट द पब्लिक डिस्ट्रीब्यूशन सिस्टम?
एग्रीकल्चर
अब पब्लिक डिस्ट्रीब्यूशन सिस्टम 24/7 काम कर रहे हैं क्या? पीडीएस
वो टाइम मतलब टाइम में हम लोग उसको दे देता है ना. अभी एज पर द रिक्वायरमेंट ऑफ द टाइम उसी पे देता है. हम लोग ऑलरेडी उसमें दे चुका है. डिस्ट्रिक्ट में जितना सफिशिएंट है हम लोग दिया है.
Okay.
और तो सब गांव में आप जो बोल रहे नहीं पहुंच पाता है, फिर भी गांव का अभी सस्टेनेबल है.
Okay. Okay, I'll come to Mr. Temjen Toy, but very quickly to Mr. Rupam Goswami. Mr. Rupam Goswami, in the last 2-3 days of the lockdown, we have seen people in some parts of Assam and outside behaving in a very, very irresponsible manner. Today, police had to open fire in Bongaigaon, because they had opened a huge market, and when the policemen went to disperse the market, disperse the people, they attacked the police with stones. So these are shocking developments, isn't it?
Really Wasbir. The last 2 days or 3 days, there are some people, they have not listened to the government instructions. So as a whole, so they came to the market, even the sabzi mandis, they have opened. So there are lots of havoc in some of the places of Assam, but almost 90% people are really maintaining this social distance. So thanks to them. And this need to be taken care and strongly by the Assam police. Already Assam police has opened blank fire, and I heard that in Bangaigaon. And also they have beaten the people. Actually, this situation should not arise at all.
Right.
Because people should understand whatever the government has taken this. And government has taken the step for their security, for their life.
Absolutely, Rupam Goswami. People must demonstrate their responsibilities. It is not enough for people to only talk about their rights. They have to also demonstrate their responsibility as responsible citizens of our country. Mr. Temjen Toy, infrastructure has always been a problem in a state like Nagaland. The road conditions are not really good. And now you don't have a testing facility in Nagaland. We have heard somewhere reports that the Chief Minister of Nagaland has requested the government of India to set up immediate testing facilities for COVID-19 in Nagaland itself. So what is the latest update in that front?
Well, the Chief Minister of Nagaland has taken up with the union government for immediate setting up of the facility, as you have said, and we're actively pursuing that. But then setting up a lab of that, standard could take time. So we are sending up samples to Imphal, Guwahati, and Dibrugarh, and we have also requested the two state governments of Manipur as well as Assam to give us priority. So far, we have sent about 17 samples. Thankfully, 13 results have come. They are all negative.
Okay, Mr. Menukal John, yesterday or 2 days back, one of your nodal officers was on my program. They were saying that there was some difficulty, you are facing with, your vehicles coming into Assam with the samples. Do you still have the difficulties? Can we bring this matter to the notice of the Assam government?
Thank you so much for that. But yes, fortunately, we've been able to solve that. We have kept our police vehicles on standby, and any samples that have been sent have been taken care of by our police vehicles. So at the moment, we do not face that problem. Initially, we did have that problem because the company that was entrusted with transporting the samples couldn't do much because of the lockdown. But at the moment, that problem has been solved.
Okay. Mr. Suresh Babu, what about this question will also, after a while, go to Mr. Temjen Toy. Dr. Suresh Babu, what about, students from Manipur or workers from Manipur who are stranded? Because if we look at what is happening in UP and Bihar, their migrant workers are having a terrible time. They are walking on the roads for hundreds of miles before they are picked up by the authorities. Now, what is the situation about citizens from Manipur who may be stranded because of the lockdown? What is their number? What are you doing about them?
You see, whoever is contacting us, we are trying to help them. We are in touch with the other state governments. In fact, the Ministry of Home Affairs has opened a common group where we communicate with other chief secretaries. Now, secondly, we have nominated the resident commissioner in Delhi to connect with all the people, and these helplines are already circulated into the social media, and people are able to get access to that. Thirdly, we have opened a central control room here where the 24/7 access is there for people who need any assistance.
Okay,
in Manipur Bhavan, Calcutta, and in Manipur Bhavan, Guwahati.
Okay, Dr.
Yeah.
Suresh Babu, do you have
Yes,
a figure? Is there a figure, do you have an estimate of how many people from Manipur are still outside, who may have been stranded?
You see, we are getting figures of 2030 like in different places. So we have requested the concerned police authorities in that state to put them back into the hostels or the place where they are staying, and the other states are really helping us. And
okay.
We are dealing case to case because we are not in a big number actually.
All right. Alo Libang ji, अरुणाचल का जो छात्रा छात्रियां हैं और अरुणाचल का लोग कितना बाहर में स्ट्रैंडेड हो रहा है, आपको कोई फिगर्स है क्या अभी?
एग्जैक्ट फिगर अभी मेरे पास में नहीं है, लेकिन है हम लोग कम्युनिकेट कर रहा है जो डीआरसी गुवाहाटी का बताया है और एआरसी और दिल्ली का उसको पीआरसी को बताया है, और वहाँ पे जो हम लोग का हैदराबाद में कुछ फंसा हुआ था उसको दिल्ली में आने के लिए बोला है, और जितना भी आउटसाइड में स्टूडेंट है अभी तक नहीं आए उनको वहाँ में बैठने के लिए हम लोग ऑर्डर दिया है गवर्नमेंट का हेल्प में.
Okay, this is an interesting suggestion. Those people who are stranded, Arunachal government has advised them to stay put wherever they are, and the government is going to assist them. Mr. Temjen Toy, the same question goes to you. What about people from Nagaland who may be in difficult situation outside because of the lockdown?
Well, yes, we have thousands of students as well as people working in different organizations all over the country. And then we, in the state government, we were apprehensive about their well-being. And so a lot of publicity was made through the social media on whom to contact. In fact, I had given my own personal email to anybody who could contact me for any, in case of any difficulties, including harassment and racial profiling. we have been receiving, I have received a few emails from various states, and I've immediately taken up with those state governments, especially Maharashtra. Maharashtra government was very prompt in taking action. They had, in fact, even appointed a nodal officer. And then now that nodal officer who was appointed for Nagaland is the nodal officer for the entire country, so far as Maharashtra is concerned. So, and then the Honorable Chief Minister also from his Chief Minister's Relief Fund has sent money to the various student unions. We have students' unions in all the major cities, and they are actually very actively getting in touch with the other fellow Nagas who are there in those particular cities. Some of them have sought for help, and we have been remitting money to them to look after their welfare.
Okay, in fact, I'm really grateful for the two chief secretaries as well as the health minister and other guests to be on the show, because, this kind of assurance coming from both the chief secretaries of Nagaland, Manipur, and the honorable minister from Arunachal Pradesh and the other guest, this really goes to assuage the, confusion, remove the confusion, and give a lot of reassurance to our people from the northeastern region who are outside, from Nagaland, Manipur, Assam, elsewhere, who are outside in these difficult times, that their government are there to look after them. I'll have to go for a break, a very short break. Don't go away. I'll come back and continue this very engaging conversation in these very, very critical times. I'll be right back. Welcome back. This question goes to, you, Mr. Alo Libang ji. Abhi community ka kya role hai? Community leaders ka kya role hai? Because we are in the northeastern region, jahan community jo hai, ethnic groups, gaon budas and everybody, they have a very important role. तो अरुणाचल में क्या हाल है? आप इनको यूटिलाइज कर रहे हैं क्या अवेयरनेस के लिए?
हाँ जी, हमारे यहाँ गांव बुरा लोग और जितना कम्युनिटी लीडर्स है, CBOs बेस्ड ऑर्गेनाइजेशन, स्टूडेंट यूनियन, सब साथ दे रहा है. सब साथ दे के गाँव में इन लोग क्वारंटाइन, फिर अपना गाँव को क्वारंटाइन ही कर रहा है लोग से. और जितना जो अपना पुराना रीति रिवाज का स्टाइल में पूजा करके हम सब बैठ रहे हैं बाहर नहीं निकलने के लिए. और बाहर का लोग को भी आने नहीं देता है अपन गांव में, और बाहर भी अपन गांव का लोग बाहर भी नहीं जाता है. उसमें गांव बुरा लोग, CBOs लोग, स्टूडेंट लोग एक्टिवली कोऑपरेट कर रहे हैं.
We had very interesting visuals from Arunachal Pradesh, where the villages were actually locked down. They were putting with bamboo poles. They have locked down their villages, not allowing anyone to come in or anyone to go out from their respective villages in Arunachal Pradesh. I think that is a very unique traditional step. Mr. Tamjan Toy, is there similar incidents in Nagaland as well, where the community is playing a lead role in these critical times?
Yes, especially in the villages, the village councils have taken it upon themselves to enforce the lockdown. And we also have a number of instances where, they have actually put bamboo barricades at the main entrances of the villages.
Bamboo barricades. So these are unique ways, in the northeastern region. These are some of the lockdown notice. As you can see, these are bamboo poles. This is, I think, as a critical bridge leading to a village which has been locked down by the villagers. Dr. Suresh Babu, I'm coming to you, Mr. Menukal John. Mr. Suresh Babu, now the government of India has come up with this massive and unprecedented relief measures. But the biggest challenge for administrators like you is to make sure that the needy people actually get the relief. How difficult is this as an operation?
You see, it's a routine operation which we are doing. Every month we used to distribute this. Rice which comes from the public distribution system is going to the villages. The state government of Manipur has taken a decision that 1 month ration, what is entitled to them, will be given free of cost. Now Honorable Prime Minister package has come where we are going to give double the quantity for another 3 months, out of which that extra amount will be free of cost. We have stocks available in Manipur to sustain for another 2 months. There is no problem. As far as the rice is concerned, now we have to move the dal and other essential commodities. Now the local representatives, the MLAs, the ministers, the civil society organizations, the public distribution fair price shops, everybody is actively associated with the district administration in ensuring that this goes to the people. The public CSOs are playing a key role in mobilization.
Civil society
And simultaneously, if you come back to the CSO, civil society organizations play a key role in Manipur. See, if you see the same thing of lockdown is happening, the social distancing is enforced so strictly by the community. More than by the government, the social local people are imposing it. Even Imphal city itself, every street has been locked down by the people. In fact, I am finding sometimes difficult to get the staff. Those staff of that area, when they come for duty, the community is not allowing them to return back to their lakai.
Okay.
So this is the amount of strict social distancing that is being followed right now.
I think these are good stories of awareness. Actually, this is an aware community. Because of the awareness level, perhaps they are doing this, which is good times, which is a good thing in as far as the in a pandemic like this. Mr. Menukal John, from the medical point of view, when we talk about preparedness, what is the lesson learned? COVID-19 is also teaching the whole world several new lessons, whether it is medical preparedness is one of them, that we cannot take anything for granted. Now, in the last 2 weeks or 3 weeks, when, India has become extremely proactive, what is the lesson learned by the health authorities in Nagaland? Are you planning to set up exclusive hospitals? Are you going to shift focus now to healthcare?
Oh, yeah. As mentioned by the Chief Secretary earlier, the question that you have put, we have already identified 5 hospitals which will be dedicated as COVID hospitals. That we have done it. And what we have done with the inmates who are already in those hospitals, we have tied up with the private players for which we are shifting our distant patients who are there in the government hospitals, and we're shifting them to the private players' hospital. And then we have made arrangements with them. In this forum, I think I would be failing if I do not acknowledge the role that has been played positively by the private players in my state. And let me also add to what my Chief Secretary has said earlier, we acknowledge the role played by the villagers, village councils, and to add it, the village students union and the youth organizations of each and every area.
Right.
The way they have come forward to implement the lockdown has been tremendous. We'd like to acknowledge that.
No, my question to you once again, Mr. John, is this. Okay, now this is a temporary measure. You are converting a few hospitals into exclusive COVID hospitals. But what about permanent? Have you also realized the fact that Nagaland needs some permanent healthcare facilities, like proper hospitals, some more hospitals need to come up? Is that one of the lessons that you have learned in the last 3 weeks?
Definitely. Oh, definitely. Definitely.
Mr. Temjen Toy, is there talk about that going on? Is the government thinking on a long-term, health infrastructure boost?
Oh, yes. Health is definitely now going to get more attention from the state government. And then when we look at hospitals, the manpower, the equipment, the various facilities available in the hospitals, this has been an eye-opener for us. And we are looking towards upgrading all our district hospitals initially, and thereafter the community health centers.
Okay, good news coming from Kohima there. The planning to upgrade all the district hospitals, and then of course the focus on other hospitals. Alo Libang ji, अरुणाचल में क्या हाल है? आपके सरकार ने क्या प्लान कर रखा है हेल्थ केयर फैसिलिटीज को अपग्रेड करने के लिए? अभी जो है टेम्पररी मेजर्स आप लोग सब ले रहे हैं, ये दिस इज अ वेरी गुड थिंग, लेकिन परमानेंट बेसिस में हेल्थ केयर को इम्प्रूव करने के लिए क्या प्लान है आपका अभी? मतलब व्हाट आर योर बेसिक प्लान्स इन द नेक्स्ट फ्यू वीक्स, नेक्स्ट फ्यू मंथ्स?
आपने जो बोला है, अभी जो ये कोविड-19 पैंडेमिक ने हमको एक लेसन दिया है सारा दुनिया को,
जी
तो उसी कारण से हम लोग डिस्कस हो रहे हैं। अभी के लिए टेम्पोरल के लिए हम लोग जो कोविड-19 का टोटली डेडिकेटेड है, जो हमारा तोमोरीबा ट्रिम्स हॉस्पिटल को हम लोग डेडिकेटेड कर रहा है। उसका बाद आने वाले में हम लोग ऑल डिस्ट्रिक्ट का हॉस्पिटल को आप जैसे बोल रहे हैं अच्छा करना पड़ेगा, क्योंकि ऑल फैसिलिटी हम लोग कोशिश करना पड़ेगा। बहुत तकलीफ से अभी गुजर रहा है हमारा अरुणाचल प्रदेश में, क्योंकि जो भी मेडिसिन आता है, जो भी मटेरियल्स आता है वो थोड़ा आसान होके आता है। तो हमारे यहाँ में कुछ लोकल मैन्युफैक्चर भी नहीं है, कोई से प्रोक्यूरमेंट के लिए भी तकलीफ है। तो इसलिए हम लोग भी इस लेसन को सीख के सारा जितना भी हॉस्पिटल जहाँ जहाँ मेन कैटरिंग हो सकेगा उस मेडिकल को हम लोग अच्छे से अपग्रेडेशन करना पड़ेगा,
राइट।
जितना भी फैसिलिटी का।
I'm coming to you, Mr. Rupam Goswami. Now I'm joined from Shanghai, the megapolis in China, by Ms. Madhumita Bhuya. She is a resident of Shanghai, originally from Assam. She is the founder of the Chaiti Arts Foundation that promotes Indian classical music and dance in China. Ms. Madhumita Bhuya, welcome to Notice Tonight. Now my question to you, first of all, what do you exactly do in Shanghai, and how has life been for your family in Shanghai last month, last more than 2 months?
My name is Madhumita Bhuya.
Yeah.
I've been living in Shanghai for the last 12 years. I'm a shipping and logistics professional. Apart from shipping and logistics, we try to promote Indian music and dance in China, that is classical. We have a foundation called Chaiti Arts Foundation. We closely work with Indian Embassy, Indian Consulate, and different Chinese art and culture promoters. We invite artists from India to China. We organize workshops. Also,
Right.
we organize events. Yeah, that's what we do actually. Basically, the promotion of art and culture in China. We try to popularize Indian classical music and dance in China.
Okay. All right.
Yes, life has completely changed in the last 2.5 months. At the time of this COVID-19 thing happened and it went worldwide, I was traveling. But I came back to China because the effort government is taking, the decisions they have taken, they're taking, it gave us a sense of security. All our friends living in China, you know, they have all the belief that what government is doing, that is good for the Chinese people.
Absolutely.
They accepted government decision of this lockdown. They stayed at home, we stayed at home, social distancing. We did not meet any of our friends, we didn't go to any restaurants, you know. Like, as I mentioned, that we tried to promote Indian classical music and dance in China. All our programs, workshops.
Now you know, Ms. Madhumita Bhuya, what has been your survival mantra during these critical times? What has been your survival mantra really?
My survival mantra in this critical time was, of course, the social distancing. Stay home, stay safe. We didn't meet anyone for a long time, no social gathering, not going out. At this moment, we have started going out, yes, but those days, the survival mantra was social distancing, stay at home, and stay safe.
All right, social distancing the key. Now, what is the lesson learned and what do you want to tell the people of Assam and the Northeast as a whole, you know, Ms. Madhumita Bhuya? What is the lesson learned and what do you want to tell? This is my third question to you, Ms. Madhumita Bhuya. I have some more questions to you. Yes.
The lesson learned is what I feel is the basic hygiene. Many times actually we forget about our basic hygiene, right? We go out, we
can
come
have everybody
back,
on the
you know,
screen.
we pick up food, we eat, you know. Just forget about what the world is talking right now, like anti-China or whatever it is. It doesn't matter how it started. It matters how did they respond to this problem. And they responded very well. And we need to learn from that. We need to follow the instructions. We need to maintain the basic hygienes,
right.
You know. And also what I feel is that sometimes nature, like this time, nature is also trying to teach us many things. And also we got to know, like we learned it in last 2.5 months that we are not beyond nature.
Absolutely.
We have to respect nature.
Absolutely, we have to respect nature. Okay.
And what I would like to tell to Northeast people.
My fourth question to you, Ms. Madhumita Bhuya, is life returning to normal or near normal in China? Are there any restrictions imposed on the people by the government?
Yes, the life is getting back to normal. The offices have started. We are going to office. But yes, we are taking the basic precautions like washing the hands, using the sanitizers and all these things. And see, economy has to get back to normal. Like, it's not that the country can stop forever, right? The world will come back to normal one day.
Absolutely,
but in China
yes.
at this moment, there are restrictions. Like, they have given us some QR codes, green passes, you know. Whenever we enter any building, we need to show it. They check our temperatures. And then we are allowed to go inside the building.
So there are
sick,
absolute protocol in place. My final question to you, Ms. Madhumita Bhuiyan, what do you think of the total 21-day lockdown in India?
See, the 21 days lockdown in India, it is a very good decision. That is the need of the hour. We have to understand one thing, being Indian citizens, that our medical facility, whether we are well equipped to handle the situation. If millions of people, they get sick, so we are not. We have to accept. So at this moment, so the best thing is stay at home, quarantine yourself, and be safe.
Absolutely.
We have to follow the government rules. Trust the government at this moment.
Ms. Madhumita Bhuiyan, I have to thank you, Ms. Madhumita Bhuiyan, joining me from Shanghai. She is an Assamese, a resident of Shanghai, founder of the Chaiti Arts Foundation that promotes Indian classical music and dance in China. Rupam Goswami, it gives us a lot of confidence seeing one of our ladies from the state, a citizen from Assam in China, confidently telling people that you can battle coronavirus. Don't be worried. Stay at home. Follow the rules. Rupam Goswami.
Exactly, Wasbir. Even I have lots of my friends in UK, USA, even China and other places across the world. They are also saying that it is not tough to fight against the corona, but you have to maintain the social distancing, which many of our friends have not understand yet. That is the most serious problem in Assam as well as India. We should understand why the government has taken such a drastic stage. Hello.
Yes, carry on.
Such a drastic step for a lockdown. It is very, very important. I, through your channel, want to request all the people of India and the Northeast to follow the rules of the government for our better future, for our life. If you don't follow these 21 days, then it may extend to 3 months, maybe 4 months, maybe 6 months. As many of the other countries, they have lockdown for 6 months. That we got the news from different places.
Absolutely,
so
very well said.
Be careful,
Rupam
be
Goswami,
safe.
Very well said, Rupam Goswami. Mr. Temjin Toy, your final comments. What are some of the 3 to 4 points that you would like to tell the people?
First and foremost, one should not panic. We are all in this together, and we should not take any panic-driven measures. Secondly, there's a lesson for all of us to learn here that together we need to work as one team and to be prepared for any eventuality. You know, on a lighter vein, I must tell you this, that for the past more than 56 years, I realized that I was washing my hands all wrong. It's because of this that I've now learned how to wash my hands properly. So, I mean, jokes aside, this is one pandemic, one war where the entire world is fighting one common enemy. And there are a lot of lessons to be learned from here on our preventive measures, on the preparedness of the government, of the various functionaries, of the citizens, and so on.
As the Chief Secretary of Nagaland, can you assure the people of Nagaland that they are in safe hands and they need not worry and panic?
Oh yes, the entire state government of Nagaland, led by the Chief Minister, is hands-on, and we are there to to solve any problem, to take any measures for the well-being of our people.
Dr. Suresh Babu, your final comments, and I want an assurance from you as well for the people of Manipur.
You see, we are with the government. We are fighting together with the people. People are also partners in this entire event. And I'm very hopeful the way the society is responding and cooperating with the administration. We are all together fighting for a common cause, and we will succeed. Government is always with them. We are always open to any suggestions, any issue that the people have got, we are there. Secondly, I want the people to respect the police. The police people who are on the streets, they are leaving their families and staying on the street, risking their life, and without much of safety and security for them, they are protecting you. Don't react to them, against them, and be sympathetic to them. Whatever they are suggesting, kindly listen and follow. Thirdly, the medical facilities are available, nothing to be panicked. And as far as the essential commodities are concerned, sufficient quantities are there. Government is there to maintain the supply chain, the entire country. All ministries are supporting it and ensuring through all the chief secretary. There's no need for a panic buying or panic situation like that.
Now, Mr. Suresh Babu,
with us, we are there for you.
Yeah, Mr. Suresh Babu, lot of destitutes and people, even if you give food grains, they don't have a place to cook. Now in Guwahati, a lot of NGOs in collaboration with the Assam police is feeding cooked food to people on the streets. Any such steps in Imphal as well?
No, there is no such case in Manipur. Manipur is a different state. You doesn't even find a single beggar on the street. Everybody is at home, and there's no situation which arises to treat people like that.
All right, good to hear that. Alo Libang ji, आपका final comments क्या होंगे? आप लोगों को क्या कहना चाहेंगे?
हाँ, मैं सबसे पहले जो मेडिसिन और इक्विपमेंट देने वाला जो फार्मासिस्ट, जो केमिस्ट, ये सबको मैं अनुरोध करना चाहूँगा इस मीडियम से, जो भी है ये इस तकलीफ सिचुएशन में हम लोग अंडर जो मटेरियल नहीं देना है, क्वालिटी मटेरियल हम लोग को देना है, जो भी देना है अच्छा मटेरियल देना है। और उसका ऊपर में मैं पब्लिक को ये अनुरोध करना चाहूँगा, 21 डेज लॉकडाउन को सपोर्ट करना है और हम लोग घर में ही रहना है और हम लोग जो गैदरिंग को अवॉइड करना है और अपने आप को स्वस्थ रखना है, तो भी हम लोग सही सलामत रहेगा।
Absolutely, very well said. Mr. John, Mr. Manukal John, were your final comments?
The lesson and the takeaway from this particular experience, I feel we should intensify our surveillance, and prevention is one of the key words that I would like to spread out here. Because ultimately we really don't know how it's going to hit us, but we have to go in for stricter vigilance, surveillance, and preventive measures. And for your information, by next week, we have already launched an app where we will be geotagging each and every quarantined person, and we'll be tracking them personally.
Okay, that is breaking news coming from Nagaland. This is a unique initiative by the Nagaland government, health authorities, that they're going to geotag each and every quarantined person to know about their whereabouts and about their condition. I think this is something that is unique and it needs to be replicated perhaps. Final comments from you, Rupam Goswami. 20 seconds.
If you ask me the four measures, then I will say stay at home, stay at home, stay at home, and stay at home.
Stay at home. Don't worry about the lockdown. You have to save the nation. You have to save yourselves. You have to save the society. Cooperate with the government, and maintain some self-discipline. That is the message coming out. And senior administrators and senior responsible political leaders appearing on shows like this, it's a humble effort on the part of Northeast Live to come up provide a single platform where we can address the concerns of the people of the Northeastern region. And I am asking the questions on behalf of our viewers from different parts of the Northeastern region. I really appreciate all my panelists for participating in the program and and hope that in the coming days, during the lockdown period, I will get your valuable time once again on the program so that we can assure our people that they have no need to fear and that their respective governments are with them in this hour of difficulty. I thank all my panelists for participating in the program and the viewers for watching the show. Good night and goodbye.
Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.